Guillain-Barré syndrome, or GBS, is a rare condition that causes sudden onset of muscle weakness, which commonly progresses to flaccid paralysis due to immune response which damages the nervous system. It was named after French neurologists Georges Guillain and Alexandre Barré, who first observed a patient with this syndrome in 1916. JBS has no definite cause. However, it is observed following respiratory infection and gastrointestinal infection, primarily caused by Campylobacter jejuni. It is also noted that surgery and flu vaccination precede this syndrome in number of cases. There are 5 subtypes of JBS, 2 of which JBS is known for, or categories cases commonly fall into. The rest are variants. Feel free to pause the video to view the demographics affected by each subtype of JBS. Let's start with how the neurons are damaged. With preceding bacterial infection, such as that of Campylobacter jejuni or Mycoplasma pneumoniae, or viral infection, such as that of cytomegalovirus or Epstein-Barr virus, axolemal damage of the neurons is possible because of the capsule of these microorganisms. The capsule contains antigens similar in structure to that of the axolema. The activation of immune cells in response produce antibodies that cross-reacts to this structurally similar portion of the axolema. This phenomenon is called molecular mimicry. This describes the axonal form of subtype of JBS. In the myelinating form, which is the AITP, the activation of macrophages by T helper cells contribute to the classification of this subtype, in which the macrophages do much of the damage. Two to 4 weeks after the onset of preceding respiratory or gastrointestinal infection, complaints of paresthesia or tingling begins to arise, starting from the end of the appendages, the toes and the fingertips, to the ankle and wrist. It is also good to note that JBS symptoms appear to be symmetrical. As the condition progresses, pain may also be felt, usually in the shoulder girdle, the back, the buttocks, and the thighs. Patients with severe condition may even feel pain in the slightest movement. Further into the progression, muscle weakness becomes more significant. Reflexes delay or absent at all, and affect respiratory muscles as it becomes flaccid paralysis. Not only will JBS affect the respiratory system, but also the other systems, through the damage of the autonomic nervous system. The diagnostic workup for GBS includes biochemical screening, CSF studies, and neurophysiology studies. In biochemical screening, it includes electrolyte levels, liver function test or LFT, creatine phosphokinase, and erythrocyte sedimentation rate, or ESR, which usually have an increased result. The electrolyte levels are there to help distinguish it from other symptoms. In CSF studies, it includes protein levels and WBC counts. This test helps in distinguishing diagnosis from poliomyelitis and lymphoma. In neurophysiology studies, nerve conduction studies help by measure the nerve conduction velocity, and electromyography, which stimulates the muscle responsiveness. Both tests are decreased in result in patients with GBS. And an extra information, stool culture for C. jejuni will also help in the identification of GBS. Treatment of GBS are mainly by flushing the circulation of antibodies and other immune substances, such as by plasmapheresis and intravenous immunoglobulins, contributing damage of neurons, and by life support and close monitoring to the patient's overall health. Antibiotic therapy may also help, especially in cases of severe symptoms, that is, paralysis, due to risk of pneumonia. Furthermore, anticoagulant therapy may be advised to prevent deep vein thrombosis. Aftercare therapies such as physical or occupational therapy may help recover the patient to the fullest faster. Speech therapy may even be considered if the damage affected the cranial nerves, or even psychological therapy. To see some cases of this condition, please check the description below. Thanks for watching.